Hey guys, thank you for visiting my channel, Medical Assistant with Miss K. If this is your first time visiting, welcome. My name is Kendra, aka Miss K, and I'm a medical assistant instructor. So today I'm going to be responding to a question that I got on the channel that I think is a good question, and I wanted to respond here on video because some of you guys may have the same question. Now, this is in reference to the blood pressure video that I did a while back. If you haven't seen it, I'm going to link it below just in case, any of you guys may be watching this and you haven't seen that video. So this person says, why was it pumped up to 180 versus 200 versus a lower number? Was there a prior discussion with the patient to determine previous readings and or medications which may factor? So let me just say this. This person is referring to the fact that in that video, I went up to 180 when checking the blood pressure. Now, let me just say this. I've been doing this for the end of this year will make 20 years, right? And I'm just a creature of habit. It's just something that I do. If I'm not familiar with the patient, it's a lot of times that's just, I kind of default to going up to 180. Sometimes I'll go a little lower, but it kind of depends. But I'm going to explain to you guys in this video, how you know what you need to go up to. And as far as asking about if their previous readings play a factor, yes, they do. So I work in cardiology right now on call, PRN, and I used to work in this office years ago full time. And working in cardiology, you see a lot of the same patients, right? Some of them come every month, every few months. And so you kind of know what their normal readings are. You're looking in their chart, you know what their readings are. And if I have a patient who I know normally has high blood pressure, I'm going to go up a little higher because I know this person has high blood pressure. Same thing for low blood pressure, right? I'll look at a previous reading, or let's just say I just checked the patient's blood pressure. I will, let's just say I just checked it was 140 and I'm going to check it again. I know I don't need to go up to 200 because I just checked it. It's not that high. I don't need to go up that high. Okay, so that's kind of what I do. So, in reference to you asking if the previous readings, play a factor, yes, it does. For me, that's how I kind of decide how far I'm going to go with those patients. Now, let me explain to you guys how you know how far you need to go. So I've already done videos on how to read this. I'm not going to go into that on this video. But you guys know when you place this on your patient's arm, you're going to be checking the blood pressure at the brachial artery, right? That's the inner arm right there at the bend, right? And so once you put the cuff on your patient's arm, what you want to do is you want to palpate that brachial artery and you'll feel the brachial pulse there, okay? So while you're palpating that brachial pulse, you're going to be feeling that pulse, right? And you want to take your cuff and you're going to pump, right? You're going to keep pumping until you no longer feel that brachial pulse. Whatever number this is pointing to, when you no longer feel the pulse, you just want to go up about 30 millimeters of mercury higher than that number. For an example, you're pumping, you no longer feel your patient's pulse at, let's just say 120. So that means you're going to go ahead and deflate it, give it a little bit, maybe 30 seconds to a minute before you try to check it, right? And then once you're ready to check it, you're going to pump up to 30 millimeters of mercury above that. So you're going to go up to 150, right? And then that'll give you an accurate systolic reading. So hopefully this was helpful. I just wanted to make sure you guys knew that that's the correct way of knowing how much you need to pump up. Again, I'm a creature of habit. I've been doing this a long time, so I just have different ways of doing it. When I was in school, I remember my instructor taught us to go up to 200, right? She never, back then, I don't remember them explaining to us how to actually know what to go up to. But hopefully this was helpful to you guys. So anybody else that was wondering, and to the person that asked this question, hopefully this was helpful. And one thing I want to mention before I end this video, I just want to point out this necklace that is live on my site. It's a customized necklace. You guys can add your name to it. It's a stethoscope necklace. It is live on my site. I will leave the link below. Thank you again for visiting my channel. Be blessed.